Afternoon, ladies and gentlemen. It's a pleasure to be here with you today. First, I did like to introduce myself. I'm Putri Lestari, or usually called Putri. I'm from Kusuma Husada University, Surakarta. I'm from the Bachelor of Farmasi study programs. Previously, did you know what urinary tract infection is? How to treat it? Well, some already know and some do not know. Okay, later we will discuss together what urinary tract infection is, how to treat it. The purpose of this presentation is to find out what a urinary tract infection is, its symptoms, and tips on how to prevent or treat it. Definition of urinary tract infection. Tract infection is a condition where microorganisms or bacteria develop in the urinary tract, which normally does not contain bacteria or other microorganisms. This infection can occur in both men and women, adults, the elderly, or children. However, in a follow-up study, it was that in women the incidence was higher than in men. Urinary tract infection is a condition when the organs belongs to the urinary system becomes infected. These organs can be the kidneys, ureters, urethra, or bladders. However, urinary tract infection generally occur in the urethra and bladder. Starting from the kidneys, residual substances in the bowels are filtered and extracted in the form of urine. Next, urine flow from the kidneys through the ureters to the bladder. Once stored in the bladder, urine will be expelled out of the body through a tube called the urethra. A urinary tract infection occurs when bacteria enter in the urinary tract through the urethra. After that bacteria multiply in the bladder, if left untreated, the bacteria can cause infection to reach the kidneys. Type of urinary tract infection. Based on part the infection, urinary tract infection or UTI are divided into two types, namely upper UTI, which is an infection that occurs in the organs located before the bladder, namely is the kidneys and ureters. This is lower at UTI, which is infection the lower part of the bladder, namely the bladder, and urethra. Upper UTI are more dangerous and should be treated immediately if left untreated. Infection in the kidneys can spread widely throughout the body. Symptoms of urinary tract infection. Clinic, clinical manifestation or symptoms that are felt can vary depending on the severity and the organs involved in the infection, but in general we can mention 1. Frequent urination and pain when urinating, sometimes accompanied by cloudy urine. 2. Urine is reddish in color and has a pungent odor. 3. Pain in the area below the navel, or it can be accompanied by pain in the base. 4. Very or chill, which means the infection has started to spread to other part of the body. 5. Nausea and vomiting if the infection spread and begins to interfere with kidney function. In general, cause of urinary tract infection is a bacteria, fungi, or virus that enter the urinary tract will overall precipitating factor or habitats that can predispose to urinary tract infection include 1. For hygiene of vital organs. 2. Frequently holding urine, especially for people who work a lot sitting for long hours. 3. Lack of drinking water. 4. Residual urine that is still a lot in the bladder even though the person has urinated. Usually this occurs in elderly patients who are accompanied by an enlarged prostate gland which is indeed a problem with urinary excretion. 5. The wrong way to wash, especially for women. 6. In people who do have a history of venereal disease. Urinary tract infection treatment and prevention. 1. Pharmacological treatment. A. Antibiotics that match urine culture so will be more precise and effective. B. Analgesic and supporting drugs for existing comorbidities. So, prepared treatment of urinary tract infection is very important because inappropriate treatment causes prolonged complaints and resistance to antibiotic is given, and this is the most important thing. If there is an antibiotic resistance, the treatment costs will also swell and often require hospitalization because the choice of antibiotic is only available in the form of injection. 2. Non-pharmacologic management. A. Enoxaparin. B. Diet. Multiply vitamin C for protection against the urinary tract. C. Ram compress if there is pain under the center. D. Adequate protein and nutrition intake. Tips and tricks to avoid urinary tract infections. 1. Increase your intake of drinking eggs to 10 glasses of water per day. Consuming vitamin C regularly because it can increase endurance and repair cells. 3. Avoid consuming alcohol, coffee because it irritates the bladder, causing frequent urination. 4. Try not to hold urine often. 5. Wash the genitals before and after coitus. 6. Live a clean life by keeping your vital tools clean. 7. If you use a catheter, reply in the regular and quarterly to the expert, especially for women. A diligent change pads if you are menstruating. B. Avoid wearing thick pants. Wash immediately after intercourse. Wash the genitals from front to back. E. Avoid using perfumes, deodorants on the genitals because they can potentially irritate the urethra. Thanks. Any question? You can find me at Gmail and Instagram. Thank you.